Hello students, welcome to EPG Pathshala. I am Dr. Renu Tyagi from Sardar Patel Institute. Today we will study the module Assessment of Physical Fitness under the paper Physiology and Sports Anthropology. Now let's have a look at the learning objectives of this module. After reading the module, we will be able to understand the concept of physical fitness, which relates to the health and performance. We will be able to understand the components of the physical fitness for the muscular strength and the endurance, the cardiorespiratory fitness and musculoskeletal flexibility. Then we will be able to understand the techniques or the exercises to assess the fitness level specific to each component. And then we will classify the criteria to grade the level of physical fitness. Now let's see what is a physical fitness, or what do we understand by this term. Physical fitness is a set of attributes that people have to acquire that relates to their ability to perform physical activity. It is also associated with a low risk of premature development of hypokinetic diseases that occurs due to the sedentary or sitting kind of lifestyle. A physically fit individual has the ability to carry out his or her daily task with vigor and alertness. Besides, the person will continue the kind of work without any undue fatigue and with the ample energy to enjoy the leisure time pursuit and to meet the unforeseen emergencies. The outcome of the physical fitness program for improving the health rather than the maintenance or enhancing the physical or the athletic performance. The concept of the performance related fitness compared with the health related fitness evolved. Now let's have a look at the component of the physical fitness. Now we have understood that the physical fitness can be a sports specific physical fitness or it can be a health related physical fitness. The components of the health related physical fitness includes the flexibility, muscular endurance, muscular strength, cardiovascular respiratory endurance or the aerobic power, and the body composition values associated with the low risk of the hypokinetic diseases. As we can see from this figure, the sports specific physical fitness includes the agility, the flexibility, balance, muscular endurance, power, muscular strength, cardiovascular respiratory endurance or the aerobic power and capacity, anaerobic power and capacity, and the body composition values that will optimize the performance. The health related physical fitness refers to the prevention or the rehabilitation of diseases by maintaining a desirable level of the fitness through physical activity, which enhances the physiological function and functional capacity. The individual's goal may be to participate in a substantial amount of exercise to achieve some health benefit before disease occurs, or to recover and attain the maximal function. Components of the health related physical fitness, as discussed earlier, include the body composition, cardiorespiratory fitness, musculoskeletal flexibility, muscular strength, and the endurance. Now let's have a look at performance related physical fitness or the sports related physical fitness. It directs towards optimizing the athletic performance in sports activities. It not only facilitates the health related fitness but also the skill related component such as the agility, power, balance and coordination as shown in the figure. Let's have an idea about the relative proportion of fat and fat free tissues in the body. The assessment of the physical fitness is essential to optimize the individualized exercise training program, reduce injury, increase the career longevity, and maximize the sports performance. The multifaceted nature of the sports performance require a mixed training method approach for an effective improvement in various components of physical fitness. This relates to the initial level of physical fitness component and can be enhanced to a maximum level dictated by the genetic endowment. The importance of fitness assessment is not limited to develop a training program but also includes screening for risk of heart diseases and other chronic diseases. Therefore, a physical fitness assessment must be integrated into all activities of daily living as well as the physician examination to assess and promote health. The body composition is the relative proportion of the fat and fat free tissues in the body. An understanding of the body composition is important because of the influence it has on both experience performance and the general health. The reduced body fat level correspond to reduced body mass and that has to be accelerated during the exercise or any sports activity. It provides the force required to change the direction or the speed during the jump or performed activity against the gravity, etc. An athlete with more body fat would produce more heat due to increased metabolic rate but shield the dissipation of heat from body to environment. Considering the general population, increased body fat, termed as obesity, has emerged as a global epidemic. It is associated with the elevated risk for the range of chronic diseases like cardiovascular problems, diabetes, blood pressure, and various types of cancer. Obesity results from the imbalance between the calorie intake and the calorie expenditure, regulated by the complex interaction between genetic and the environmental factor. There are a variety of techniques to measure the body composition in both field and the laboratory, and each approach has different level of accuracy. The dual energy X-ray absorptiometry DEXA has been accepted as the gold standard, but it requires expensive equipments and convenient place as well as an individual is exposed to the radiation. Therefore, more practical alternative to estimate the body composition at whole body level using the indirect methods have been developed simultaneously. These indirect methods include the underwater weighing, bioelectrical impedance, and the anthropometric measurements. Let's have a look what is the DEXA technique. The dual energy X-ray absorptiometry method requires the low-level X-ray radiations exposure in the form of two photon beams, the one with the low energy and the other with the high energy. It is based on the differential transmission of energy beam which relates to the thickness, density and the chemical composition of bone, lean tissue and fat as it passes through the body. The amount of each photon beam absorbed by the atoms of the bone minerals and the soft tissue of the body are recorded during the scan and used to estimate the bone mineral and fat free soft tissue and the fat tissue content of the total body using the algorithms. Let's have a look at the technique of underwater weighing, that is the densitometry, to assess the physical fitness. The underwater weighing or the hydrostatic weighing estimate the fat mass in relation to the fat-free mass by measuring the density of the body using the formula density is equal to body mass divided by the body volume. The body volume here is estimated on the basis of Archimedes' principle, which states that the weight of an object lost in the water is equivalent to the weight of the water displaced during the immersion. When a subject is submerged in the water, the body volume BV is equal to the loss of weight in water corrected for the density of water corresponding to the temperature at the time of submersion. So, the body volume can be calculated using the equation to have an idea about the body composition and hence the physical fitness. The body density is then converted to percent body fat using the Series equation, that is the body fat is calculated as the ratio of 4.95 divided by density minus 4.50. This whole is multiplied by 100 to get the body fat in percentage. Now let's have an idea how to measure the body composition using the bioelectrical impedance analysis, that is BIA. In this technique, the estimate of the body composition are based on the difference in electrical conductive properties of various tissues to the non-conducting material, which offers the resistance to the flow of electric current. Water, due to the dissolved electrolytes, is the good conductor, whereas the body fat has a relatively poor conductance property. Hence, lean tissue, which is rich in water and electrolytes, has minimal impedance and increases to a maximal when all lean tissue is replaced by the fat tissue. Here the impedance signifies the opposition of a conductor to the flow of an alternating electric current. Therefore, the fat-free mass FFM and the fat mass Fm can be calculated from the difference in the conductivity. The bioelectric impedance analysis measurement assumes body as a cylindrical shaped ionic conductor with homogeneous composition, a fixed cross-sectional area and a uniform distribution of the current density. The conductive volume V, which represents the fat-free mass, relate directly to the square length of the conductor S and inversely correlated to the resistance of the cross-section area R. While the P is the specific receptivity of the conductor, yielding the equation V is equal to P multiplied by S square divided by the R. The anthropometry is another way of assessing the body composition. And in anthropometry, the body mass index is one of the most established anthropometric indicator used for the clinical indication of the body adiposity. The body mass index or the BMI is calculated as the weight in kg divided by the height in meter squared, as it can be seen from this figure also. It correlates with the total body fat and relates to the cardiovascular and all-cause mortality. However, the ability of BMI to identify an overweight, obese individual has the challenges, as it does not distinguishes excess fat mass or due to the excess lean mass in among them. The Asian Indian tend to have a higher body fat percentage for a given body mass index and develop the chronic diseases at a lower BMI level as compared to the white population. Therefore, the cutoff criteria to classify the individuals into overweight or obese has been developed for the global comparison as well as separately for the Asian population. So now let's see how we can assess the physical fitness using the anthropometry. The anthropometry quantifies our body components into different body dimensions. It quantifies the body components by measuring the body size, circumferences, and skin fold thicknesses. The technique of anthropometry, being portable, non-invasive, and inexpensive, are quite useful in the field-based large epidemiological studies. There are several anthropometric indices which can be computed statistically using the different anthropometric dimensions. For instance, the waist circumference can be used to assess the central adiposity. That is by computing the waist hip ratio, waist height ratio, and the conicity index. Now let's see what is waist hip ratio. As the name suggests, the waist hip ratio is the ratio of waist circumference in centimeters to the hip circumference in centimeters. The waist height ratio is WHTR, is the ratio of waist circumference in centimeter to the height of the individual in the centimeters. And the last is the conicity index, that is the CI, which can be taken as a ratio of waist circumference in meters divided by 0.109 into square root of the body weight in kg divided by height in meters. So this way we can assess the physical fitness measure using the anthropometric technique. Now let's have a look at the anthropometric measurements like the body circumference and the various anthropometric indices which can help us to study the body composition. Several epidemiological evidences suggest that an increased accumulation of adiposity in the abdomen is independently associated with a higher risk for morbidity and mortality than the peripheral distribution of body fat. The body mass index or the BMI limits the assessment of body fat distribution pattern and hence water circumference provide a non-invasive field-based method to identify mortality or morbidity risk associated with the central adiposity. There are several anthropometric indices which can be computed using the waist circumference to find out the adiposity, which are clearly seen from this picture. Now let's have a look how we can use the skin fold thickness measurement to assess the body composition. The estimation of the body composition using skin fold measurement is based on the principle that approximately 1/3 of total body fat is the subcutaneous fat and the rest is visceral fat or the fat deposited on our body organs. It involves the measurement of the thickness of the skin fold by holding a fold of skin and fat and just holding it away from the underlying muscles at various sites in the body, for instance at biceps, at tricep, at subscapular region or suprailiac region or abdominal region or the calf region. The assessment with the skin fold caliper correlate well with the hydrostatic weighing, but the reliability of the skin fold measurement depends on the precision to measure the exact anatomical location indicated and depends on the practice of the technique. The sum of the skin fold thicknesses, known as the grand mean thickness GMT, can be used to rate the individual according to the fatness and as well as to evaluate the changes in the body fat following the dietary restrictions, exercise conditioning, or both. The sensitivity of our different skin fold sites towards the accumulation of the body fat can be estimated as relative percentage of the each skin fold thickness to the grand mean thickness. Several population specific regression equation utilizing the skin fold thickness have been derived to predict the body density, which are used to estimate the percent body fat using the series equation. As more fat is deposited viscerally with aging, age adjusted equation should be used. The accuracy is also compromised with extremely obese or the lean individual. This picture shows us the generalized equations to estimate the body density using the skin fold thicknesses. As we can see from this figure that there are different equations made for the men and the women. Besides, the equations have been prepared using the different skin fold thicknesses. For instance, among both men and women, as we can see, the equation have been made or prepared using the 7 sides formula or by assessing the skin fold thickness at the 7 different skin fold sites in the body. Similarly, separate equations have been made using the 3 sites at the body. So, we can always find out the body density among men and women separately using those specific equations. Now, let's have a look at the assessment of the body composition using the cardiorespiratory fitness. The cardiorespiratory fitness of an individual may be defined as the ability to perform the moderate to high intensity exercise involving large muscles group for a prolonged period of time. It is primarily limited by the oxygen transport capacity of the cardiovascular and the pulmonary system. Therefore, the maximal oxygen consumption, that is the VO2 max, that an individual can utilize during maximal or exhaustive exercise represents the gold standard measure for the cardiorespiratory fitness. It is generally expressed in liters of oxygen consumed per minute or milliliters of oxygen consumed per kilogram of the body mass per minute. Traditionally, a plateau in oxygen consumption despite an increase in workload determines the attainment of VO2 max. As we can see from this figure, it shows us the fitness rating corresponding to the VO2 max values among women and men separately as per their age groups. As we can see from this table that for a woman of age group 18 to 29 or for an adult woman, the value of VO2 max of about 50 and above is generally considered to be a superior fitness level. However, for a man of similar age group, the value of more than 56.1 is considered to be the superior fitness level. So we can have a look at the different physical fitness level corresponding to their values of VO2 max, which has been graded from superior to excellent to good to fair, poor and the very poor categories. Now let's have a look of a comparative assessment of a maximal versus a sub-maximal exercise test to assess the physical fitness. The maximal exercise test has been considered the gold standard for assessing the cardiorespiratory fitness. During such exercises, individuals are supposed to work out to the limit of intense physical exercise, bringing the individual to their maximal aerobic output. Under these circumstances, among many individuals, especially with the chronic disease or disability, the assessment is limited due to pain or fatigue rather than exertion. It carries a substantial burden for both the subject and examiner in terms of time, effort, and risk. To reduce this burden, various sub-maximal exercise protocols have been developed. For instance, by the Noonan and Dean and by Haskell and Kerman. These protocols eliminate the cardiovascular fitness based on the response of the heart rate to a set work rate or work loads. These values are then extrapolated using the standardized equation to predict the VO2 max. Now let's see how we can assess the fitness or the cardiorespiratory fitness in particular using a open circuit spirometry. In clinical and research setting, the open circuit spirometry or a lab-based technique represents the most widely used direct method of estimating the VO2 max. In this, an individual performs an ergometric test with progressive loads and the air inhaled or exhaled is measured for volume and composition. The individual inhales the atmospheric air and then exhale it through a low resistance valve into either large canvas bag or the rubber meteorologic balloon or directly into a gas meter, which continuously measure the volume of the air. A sample of the expired air is analyzed for fraction of oxygen and carbon dioxide using biochemical or electronic analyzer. Since during exercise, body utilizes the oxygen, the exhaled air will contain less oxygen and more carbon dioxide than inhaled air. Therefore, the difference in the oxygen content of the inhaled and the exhaled air determines the oxygen uptake. The indirect estimation of the cardiorespiratory fitness includes the graded exercise test. That is, individual exercise at gradually increasing workloads. Now, estimating the fitness level of an individual is based on the similar principle as in the direct assessment of the fitness, with only one exception, that the oxygen consumption is not measured directly, but it is computed by using a equation. In the graded exercise test, the exercise begins at low workload and the maximal workload is determined by the speed and the elevation of the treadmill or the resistance if a cycle ergometer is used. Now, after that, the heart rate and blood pressure is measured during the entire test. The protocol for the graded exercise test includes a low intensity warm-up phase followed by a progressive and continuous exercise and slow down period. To ensure that the test is being performed at the appropriate level of intensity, the target heart rate, that is THR, using the heart rate reserve method is calculated. The target heart rate is equal to the heart rate reserved multiplied by the desired intensity plus the resting heart rate. The heart rate reserve signifies the difference between the maximal heart rate and the resting heart rate. So, the target heart rate becomes equal to the maximum heart rate multiplied by the 220 minus age factor. Then using the heart rate and the desired heart rate, the target heart rate is achieved. Now we have studied the graded exercise test. The treadmill test is another graded exercise testing. This test is performed on a motor driven treadmill with variable speed and incline. The workload on the treadmill is raised with an increase in speed or incline or both, expressed as miles per hour and percent grade. The speed of the treadmill varies up to 25 mph and incline is measured in units of elevation per 100 horizontal units, and it's expressed as a percentage. The population specific and generalized equation are shown in the table that have been developed to estimate the VO2 max from exercise time. The treadmill protocols of Balkes and Bruce are the most widely used exercise test. Let's have a look at the Bruce protocol in detail. The Bruce treadmill protocol is a multi-stage treadmill protocol in which the workload is raised by changing the treadmill speed as well as the grade. During first stage, that is first to third minute, an individual walks at a speed of 1.7 mph pace at 10% grade. At second stage, that is from 4th to 6th minute, the grade is increased by 2% and the speed to 2.5 mph. In the subsequent stages, the grade is raised by 2% and speed either by 0.8 or 0.9 mph until the individual achieves the maximum heart rate or is exhausted. The duration of the exercise till an individual is performing is used in the equation to estimate the VO2 max. The modified Bruce test, which is suitable for the high risk and elderly individuals, include two more steps at initiation, while rest of the protocol is similar to the standard Bruce protocol. This table shows us the predictive equations for the VO2 max according to the specific protocol of Balk and Bruce. As this table shows us the population category with the respective equation to be used to calculate the VO2 max in that particular population group. For instance, as per the Balk protocol, the equation for the active and the sedentary men can be equal to 1.44 time plus 14.99 to calculate the VO2 max. However, as per the Bruce protocol, the equation for the same category, that is active and sedentary men, the VO2 max can be calculated as per the equation is equal to 14.76 minus 1.379 multiplied by time plus 0.451 multiplied by time square minus 0.012 multiplied by time square. So we can have an idea that the separate equations are there for the separate group of individual. This picture shows us the nomograms for the graded exercise test as per the Balke protocol or as per the Bruce protocol exercise test. We can have a look and we can assess the oxygen uptake as per the different test conducted by the Balke protocol or by the Bruce protocol to have an idea of the VO2 max values as per these separate standards. The another type of graded exercise testing is by the cycle ergometer. The cycle ergometer, as can be seen from this picture, is a preferred modality when exercise test is to be conducted on individuals with conditions affecting their ability to walk safely on treadmill, such as the balance instability, severe obesity or orthopedic conditions. The workload in the cycle ergometer is raised by increasing the resistance on the flywheel. Also, it requires subject cooperation in maintaining the pedal speed at constant pressure, usually 50 to 60 rpm. However, in modern electric ergometers, an electromagnetic braking force adjusts the resistance for slower or faster pedaling rates. Thereby, it avoids maintaining constant pedaling rate. The oxygen consumption at target heart rate can be calculated using the equation which can be seen here in the picture, that is VO2 max is equal to 1.8 into work rate into constant value divided by the body mass of the individual plus 7. In the equation, the work rate is given as the revolution per minute multiplied by the resistance. The constant represents the distance traveled for each pedal revolution if it were able to roll freely. Now let's have the look at different field tests to assess the physical fitness. And one of the most commonly used field test is the Harvard step test. The Harvard step test of the aerobic or cardiovascular fitness was developed by the Bruha et al. Harvard Fatigue Laboratories. It is based on the heart rate recovery following a given workload of 5 minutes or until the exhaustion. The physical fitness in this particular test is determined by the formula, that is the fitness index is equal to the 100 multiplied by the test duration in seconds, that means the test conducted by the subject with the duration calculated in the seconds divided by 5.5 multiplied by the pulse count of the subject after finishing the exercise. Now, based on the calculated fitness index, the score rating can be determined from the table shown in this picture. If an individual has scored a fitness index of more than 96, the person can be classified as an excellent fit. And if it's less than 54, he or she is classified to have a poor fitness index. The another field test is the Cooper 1.5 mile test. This test is the simplest test for assessing the aerobic fitness, requiring only a stopwatch and the running track. The individual is supposed to complete the course of 1.5 mile in the shortest possible time. The cardiovascular fitness is assessed on the basis of time taken to complete the track, and the table can be seen to find out the cardiorespiratory fitness among males and females separately. The shuttle run test is another field test to assess the cardiorespiratory fitness. This test involves continuous running between two lines 20-meter apart on flat surfaces in time to recorded beeps and is a valid proxy for the laboratory VO2 max. Then the cardiorespiratory fitness level on the basis of shuttle run test can be used to classify the men and women under different ratings or the categories on the basis of the result obtained. Let's have a look at the muscular fitness. This refers to the ability of the muscles to perform tasks which include two components, the muscular strength and the muscular endurance. The strength, as name suggests, is the ability of the muscles to exert force during voluntary contraction. It can be static or can be dynamic. Whereas the muscular endurance is the ability of the muscle to perform the repetitive contractions over a period of time against resistance. The muscular strength can be assessed by using the test of static muscular strength. Static strength is measured as the maximum force exerted in a single contraction against an immovable resistance. The test utilizes spring-loaded dynamometer for hand grip muscle as well as the leg and the back muscles. The grip strength can be assessed for both the hands, that is left hand and the right hand, which is measured by using a hand grip dynamometer. The table shows us the values for the static strength norms in different categories and for both left and right hand. The dynamic muscular strength can be assessed using the seated chest press test or by the leg press test. The dynamic muscular strength is the one repetition maximum or the maximum weight that can be lifted for one complete repetition of the movement. Let's have a look at the dynamic muscular strength among men and women. This table shows us the age and gender specific norms for one repetition maximum test leg press for both men and women. And we can see for the different age categories, there are different percentile ranks for the test. The muscular endurance is defined as the ability of muscles to perform the repetitive contractions over a period of time against resistance. Some of the exercise tests to assess the muscular endurance include the one repetition maximum or the bench press test. As we can see from this table, this shows us the muscular endurance norms for the bench press test for men and women for different age categories. How to assess the musculoskeletal flexibility? Let's have a look what do we mean by the musculoskeletal flexibility. It refers to the degree to which a joint moves through normal pain-free range of motion. Its evaluation focuses on the joints and associated structures, ligaments and muscles that cross the joints. A reduction in the tissue's elasticity and deterioration of the joint anatomy with age is shown to decrease the flexibility. The field assessment of the flexibility has been frequently limited to the sit and reach test and behind the back reach test. The table shows us the sit and reach fitness score for men and women and their categorization in the different fitness groups. This shows us the assessment of the musculoskeletal flexibility for the behind the back reach test. We can see from this table that the men and women, on the basis of their right and left behind the back reach test, shows the fitness level of the male and females in different categories. For instance, the men with the right behind the back reach test score of 3.25 is shown to be in the excellent fitness category. So students, let's summarize what we have studied so far in this module on physical fitness assessment. By now we have understood the concept of physical fitness. What do we understand by the physical fitness and the importance of the physical fitness? We have got an idea of the types of physical fitness, whether the fitness is health related fitness or it's a sports related physical fitness. By now we have understood the different methods of assessment of the physical fitness, whether a direct method or a indirect method. We have studied all the methods in great detail. We have studied anthropometry as an important method of assessing the physical fitness. We have studied the DEXA as a technique to study the physical fitness. The densitometry is a technique to study the physical fitness. The field-based physical fitness assessment test also we have studied in great details. So by now we have understood that an individual's physical fitness determines the performance level in sports as well as the health status. It involves the integrated response of various bodily functions, including the cardiorespiratory system, muscular strength and the endurance level, musculoskeletal flexibility and the body composition. And based on those things, we have studied the different kind of techniques. There are specific tests, as we have already discussed, to assess the fitness level for each of these components of physical fitness. The baseline assessment of the physical fitness level will assist in designing a particular exercise training program for an individual. These tests also help us to evaluate the effect of the exercise on disease risk factors or the probability of getting the disease and to enlist the related or required preventive measures against the particular morbid condition. Thank you.